Welcome everyone to our live healthy living event, Improving Your Heart Health. Now, we all know that your heart's important. That's probably why you're here. And so that's why we brought on some heart experts, a pediatric cardiologist and an interventional cardiologist. They are going to give you a presentation and they're going to answer your questions live. So if you have a question for either of them, you can either text me at 248-935-2562, or you can go on our Facebook or our YouTube and post a question in the comments, and we will get those questions answered for you right here live, okay? Now let's start with Dr. Nancy Cutler. Dr. Cutler is a pediatric cardiologist at Congenital Heart Center at Mott Children's Hospital at the University of Michigan. Her primary practice is seeing patients at Hurley Children's Hospital in Flint and in Grand Blanc, so you can get her expert care right here without having to drive south. She takes care of all types of heart issues from fetal through adolescence. She has a special interest in fetal pediatric echocardiography, complex congenital heart disease, and heart rhythm problems. Thank you so much for joining us, Dr. Cutler.
Sudden cardiac death in the young is rare, but when it does occur, it's devastating and has an impact on family, friends, classmates, and the community, and we hear about it. And when we hear about it, it usually happens when kids are playing sports. But in fact, only about 1 in 4 kids that die of sudden cardiac death occurs during sports. And 1 in 50,000 student athletes have such an event. So what are the type of heart conditions that we see that can cause sudden cardiac death in the young? These are primarily hypertrophic cardiomyopathy, arrhythmias, coronary artery anomalies, and kids with known congenital heart disease. So what is hypertrophic cardiomyopathy? Because this is the most common and the one that most of us are, as parents, afraid that this could happen to their kid while they're out on the sports field or the court. Hypertrophic cardiomyopathy is a genetic or inherited condition. This is a condition where it can get passed on in families. With hypertrophic cardiomyopathy, you get thickening of the heart muscle wall. The heart's made of muscle and it can thicken. And when it does, it can either block the blood flow as it's going out to the body from the heart, or a child can have heart rhythm problems that are life-threatening and can cause death from that, where their heart races abnormally. With arrhythmias, arrhythmias are heart rhythm problems where the heartbeat is not normal. So you can have a fast heart rate, a slow heart rate, or an irregular heart rate. The 2 more common type of conditions that can cause sudden death in kids are long QT syndrome and WPW, which is Wolff-Parkinson-White syndrome. This is something where the heart can race abnormally with both of them. But with long QT, this is also an inherited or genetic condition that can be passed on in families, but you may not know that a family member has it unless there's been an episode of sudden cardiac death or fainting or some type of warning sign. With long QT, you can have sudden cardiac death with sports and stress, but it can also happen with swimming, with loud sudden noises, and with sleep. So coronary artery anomalies are problems with the coronary arteries. Well, when we think about coronary arteries, and first of all, what are they? Coronary arteries are the blood vessels that feed the heart. The heart's a muscle. It needs to get blood flow to it. And when it gets blocked or clogged, that's when you have a heart attack. And we're not worried about a heart attack in kids. We're worried about problems with where the coronary arteries come off of the aorta, which is the blood vessel that feeds the heart. If these coronary arteries are coming off from the wrong place, they may get compressed or pushed or blocked during sports. Some of the warning signs include dizziness or fainting, palpitations, which is where you feel the heart racing or pounding out of proportion to what you're doing, shortness of breath, chest pain. But not all of these symptoms are heart-related. You can have asthma or chest wall pain or other conditions that are not necessarily a heart problem. But if your child is telling you that they're having any of these symptoms, talk to their doctor, talk to their pediatrician or their family doctor about this to see if any of those symptoms that they're having would warrant having a heart doctor or pediatric cardiologist see them. How do you keep your kid heart healthy? Well, to keep your kid heart healthy, it's the same as what you need to be doing for yourself to keep yourself heart healthy. It's much easier to make changes in your life to lead a heart healthy lifestyle at a younger age than it is at an older age. Things to keep your heart healthy include a proper diet, regular exercise, don't smoke, and keep at a healthy weight. Obesity is a huge problem in America today. Obesity is associated with high blood pressure, diabetes, and high cholesterol, which all are risk factors for early coronary artery disease. Coronary artery disease are the heart attacks that we worry about. And if you have more risk factors, there's an increased chance of having a heart attack in your 30s, 40s, or 50s. So that's why it's much better to try to help make healthy choices for your child early on. Eating a proper diet includes limiting sweets, limiting fast foods and fried foods, and watching carbs. Carbs are the C's: cereal, chips, crackers, cookies, but also bread, rice, potatoes. Those are the things that you want to limit the portion size when you're serving these at a family meal. You also want to try to limit dairy like ice cream, milk, and yogurt, to lower fat type of options. Absolutely include fresh fruits and vegetables in your diet. With exercise, you want to try to encourage at least 60 minutes a day of moderate intensity exercise. What's moderate intensity? Moderate intensity is if you were exercising with a friend, you could have a conversation, but you get a little bit of short of breath. That's moderate intensity. You don't have to do it all at once. And if you can't do 60 minutes, do 30 minutes or break it up into two 15-minute sections. Turn music on and dance around. Exercise is not just running. Walking at a fast rate, biking, and like I said, dancing around can be good exercise for your heart. And it can also help with weight management as well. Smoking, don't smoke. Don't even think about it. And parents know that if you are smoking, even if you're not smoking in the same room, but you're smoking in the same house or the car, and then your child goes into that room or that car, that's the same as them smoking. So your impact of smoking has an effect on them. So I encourage kids to encourage their parents to quit. Make this a family goal. Do it together. Try to encourage everybody to exercise together as a family, or eating together as a family with healthy choices and proper portion sizes. Check with your insurance company, because some insurance companies will cover gym memberships and weight loss programs. So as parents, we worry about our kids. We want them to be heart healthy. We don't want anything bad to happen while they're out playing with their friends or on a team or even during gym class. Listen to your kid. If they're telling you anything that is hurting them or bothering them, listen to them, take it seriously. And together, you guys can all, hopefully as a family, lead a heart-healthy life.
What great information. Thank you so much, Dr. Cutler. If you have questions for Dr. Cutler, you can text me 248-935-2562. Also, you can put your questions on Facebook or YouTube. If you put your questions in the comments there, we will get those answered for you live. And we'll see if we can connect with Dr. Cutler at the end of the presentations, and she'll be able to field some of those questions for you. In the meantime, let's move on to Dr. El-Khattab. Dr. Mohammed Louay El-Khattab is board certified in internal medicine, cardiovascular disease, and interventional cardiology. He completed his residency at the world-renowned Cleveland Clinic in Ohio. He also successfully completed dual fellowships, one in interventional cardiology, peripheral vascular interventions at Boston University Medical Center, and a second one in cardiovascular diseases at the University of Connecticut. Dr. El-Khattab is the Director of Interventional Cardiology at Hurley and is Clinical Assistant Professor at Michigan State University. He is also the founding partner of Advanced Cardiovascular Clinic. Thanks for being here.
Hi, I'm Dr. Al-Kitab. I'm the Director of Interventional Cardiology at Hurley Hospital, and I'm here to speak to you about the heart health in our hospital. What is the heart? A lot of us have this emotional connection with the word heart because it represents something beautiful. The heart is truly the center of everything and the machine that keeps this body, human body, alive, and it keeps it going every single day. Some would say that the heart is a hollow muscular organ located behind the sternum and the lungs. It's a purely anatomical definition. Others can say that it is the locus of feelings and intuitions. Some will say it's a firm, rather dry variety meat, which it is. But most of us will agree that it is the center of emotion, spirit, courage, and enthusiasm. It is the most essential, most vital part of some idea or experience. So why is heart disease important? Heart disease is important because of many factors, and I want to demonstrate that in the next case. So I'm going to share with you a case of a 65-year-old man who is very common, has high blood pressure and high cholesterol. This is a scenario that we see every day. The man was playing around a golf, complained of a little burning in the chest, and he deemed it to be secondary to the onions he had in his hamburger that day. Took milk and magnesia. Around dinner time, he continued to feel very uncomfortable. At about 2:30 a.m., he woke up with excruciating chest pain. An EKG was done after he was brought to a hospital, and it confirmed what we call an ST elevation myocardial infarction. In short, a very dangerous heart attack where we believe that there is a completely blocked artery. What could they do for him? Well, they gave him morphine for the pain, and then for the next 9 hours, they did nothing. Now, this is not a fictional story. It is actually real. And this story happened to a very, very important man. This was Dwight David Eisenhower, the 34th President of the United States. It's a true story because it happened years and years ago in the 1950s. He was rushed into an oxygen tent, and at the time, a very famous now cardiologist called Paul Dudley White came to care for him. He later founded the American College of Cardiology because he believed that more was needed to fight heart disease. The president at the time did receive anticoagulants, which are called blood thinners, and was confined to bed rest for almost 7 weeks. The things that happened in the country at the time in reaction to the president being ill were historical and very, very important. But what is going on? As you can see from this slide, the buildup of plaque inside the arteries, which are the blood vessels that deliver the oxygen and life to this extremely important organ, extremely important pump that keeps us alive, is blocked. When it is blocked, there is rather quick destruction of the heart cells and a death of part of this big pump. When that death happens, you can later see that the heart is not pumping as strongly, and therefore everything else in our life is not working as well. This is another picture of a real heart, and you can see how part of it is darkened and actually dead, while the other part did receive the proper blood and oxygen that it needed. A rather concerning picture that none of us would like to see ever. The prevalence of heart disease is extremely important. It is by far the leading cause of death of men, women, and people of most racial and ethnic groups in the United States, let alone the world. One person dies every 36 seconds in the United States from cardiovascular disease. One every 36 seconds. About 655,000 Americans die from heart disease each year. That's almost 1 in every 4th death. And it is an enormous cost to care for those patients, particularly when the issue is late and when we are approaching this disease process late in the game. $219 billion each year, what we can account for between 2014 and 2015. It doesn't matter how old you are. Unfortunately, we are all at risk. As you can see from this, whether people are in their 80s, 60s, 40s, or even 20s, there is a prevalence of heart disease of some sort or another. Also, if you look at major cause of death in both genders, men or women, no matter at which stage, heart disease is going to be the leading cause, even beating that of cancer. It affects almost every part of our body. It is a cardiovascular system. That means it reaches every organ, whether it's the brain, the heart, the kidneys, or the sexual organs, or the intestine, the legs, the arms. It reaches every part of our body. The variety of heart disease is extremely important because while people hear about heart attacks, there's a lot of other things that can cause heart disease. Coronary artery disease is only one of them. Congestive heart failure is becoming a major problem, particularly for patients with uncontrolled high blood pressure. Abnormal heart rhythms leading to the need of devices like pacemakers or defibrillators. Stroke, peripheral arterial disease, where the arteries in the arms or the neck or the legs are getting affected and blocked. And finally, and not the least, is that of kidney disease. Well, what causes heart disease? How do we get to this? What leads to this tremendous prevalence? I'd like to say they are the usual suspects. High blood pressure is a very, very important disease process. High cholesterol, fancy word for it is dyslipidemia. Smoking, most important and very, very common risk factor that is preventable. Probably the most preventable or most modifiable risk factor. Diabetes, which is a pandemic. Obesity, which is another pandemic. All of these things also come from a sedentary lifestyle. We cannot ignore the role of genetics, the fact that one person is more prone than another. And if they knew about it, they might exert more effort to prevent that problem. The percentage of people becoming at risk of heart disease has increased over the years. Even if you look back in the 1990s, how many people did we consider having two risk factors in this particular slide? You will see it was a lot less from 1991 to 2003, and it's even worse now. Part of it is because we're recognizing those risk factors and accounting for them a lot more than we used to do. The other part of it is the fact that we are getting more sedentary, we are following a worse diet than before, so forth and so on. Hypertension increases as we age. It's a fact. And that gets us at more risk factors as we get older. Our diet, supersizing everything, has gotten worsened over the years. And the obesity and sedentary lifestyle epidemic has tremendously increased in all states over the years. The big elephant in the room is smoking. Unfortunately, we continue to deny the fact that smoking is a tremendous risk factor, and modifying it for people will make the biggest difference. The good news is that we've been hard at work at reducing those risk factors, modifying them, and coming up with therapies, which fortunately has led to lower chance of dying from heart disease over the years. So while it's becoming more prevalent, dying from it has improved. Whichever ethnicity the patient is, African American, Caucasian, Hispanic, American Indian, across all those populations, the risk of death from cardiovascular disease has been reduced, even though the prevalence has increased. So you get the picture. What's happening in the arteries? How did we get to this point? Well, speaking of all these risk factors, what it leads to is taking one smooth lining of an artery like the one shown here to slowly have a buildup of what we call oxidized LDL or fatty deposits, making slowly but surely the lumen of the artery, which is the delivery gateway of the nutrients and the blood to the heart muscle, narrower and narrower. And ultimately, the friction becomes more and clotting develops and the artery could be closed. The artery also can close suddenly from what we call a plaque disruption. That plaque disruption can happen to many factors. One very important one is still smoking. So we don't want to just describe the problem. We want to talk about preventing it. We want to talk about educating the public about it. And we want to talk about intervention and what we can do. So what can you do? What can I do? And what can everyone do? You got to ask those questions. Am I diabetic? Because if you are and you're not treating it, you're just putting yourself at risk. Treatment is available. What are my risk factors for coronary artery disease? Do I have a strong family history? Is this something that my parents had, my siblings have, that I have to pay closer attention than the next person? Have I been checked by my doctor? Many patients feel well. They don't even go to see a doctor. They don't even know that they have those problems. And the first day they appear at the doorstep of a hospital is when they have a massive high blood pressure and already are in failure of one of their organs, such as their kidneys. And is my physician doing what it takes to change those risk factors? Are steps being implemented to change the narrative and change my future, change my health? I'd like everyone listening to this to think of hope, because everything we've described is very scary, but we're describing it because there are solutions and there are ways to help. Prevention is the main key. We do not want to get to the point where we need treatment. We want to fix the problem before it becomes severe. Common sense is needed. Sleep well, exercise and walk, exercise your brain, eat fish and fruit. Have a plant-based diet if you believe in it. Have positive attitude. Be proactive in your healthcare. Most important thing, it is never too late. Even if patients already have had heart problems and complications and heart attacks, those who work hard at it will end up at a much better place than those who actually surrender to it. Doctor, it may be very easy for you to say those things, but how can we do it? Well, it starts by knowledge. Starts by acknowledging what is my cholesterol should be, what are the most optimal numbers, and I have to say this is a moving target. As evidence and research changes or disease state changes, we accept different numbers and the guidelines change over the years, bringing newer evidence to what should be done. Know what your good cholesterol is. Know what your bad cholesterol is. Know what your glucose is when you're fasting. What's your sugar? What is your sugar over many years? What is the waist circumference? Has it gotten better or worse? Measure your ability to exercise. Don't ignore it. If the blood pressure is high but you have no symptoms, don't kid yourself. It is not a sense of security. It has to be treated. Talk to your provider whether you've never been tested for diabetes, particularly if you have family history of it. Most importantly, do your very best to completely abstain from smoking. Make lifestyle changes with healthy food, limit alcohol intake, and of course, the impossible, lower your stress level. That's prevention. How do we get to treatment of this problem? Well, the treatment comes in two different varieties. Medical, by taking care of those risk factors, and interventional. We can intervene when we need to. When we talk about medical, we talk about a moving target for the American Heart Association, the American College of Cardiology, for what is the best cholesterol. If I had a penny for every time someone asked me, but my cholesterol is good, my answer to them, it is not good for you. This is an individualized treatment. What is the interventional therapy that we can do? A lot of you must have heard about what's called the angiography or cardiac catheterization. It is a procedure where we sneak in a very small catheter through the artery that runs in the arm or the artery that runs in the leg, the femoral artery or the radial artery. And that catheter goes up to the heart so we can image the blood vessels and find out if there's a blockage. When there's a blockage causing symptoms appropriate for treatment, we are able to dilate that blockage and place behind a metal tube called a stent that will allow the blood flow, get the patient back to where they need to be in terms of free from symptoms and ability to exert themselves. This is a historical presentation of when heart catheterization started. It started many, many years ago in the 1970s when a brilliant cardiologist by the name of Andreas Grunting invented the procedure. Years before him, in the 1900s, someone figured that we can get to the heart by simply inserting a catheter in the vein and pushing it all the way to the heart. A chest x-ray was later taken and shown that the catheter actually reached the heart. Later, cardiac catheterization between major cardiologists over the years like Mason-Sones and angiographer like Charles Dotter and Andreas Grunzing came out with cardiac catheterization and dilating the arteries using the balloons. In fact, the first time it was done was in 1977, and when the artery was checked 1 month later after it was dilated, it was still wide open. Now we have come a very long way from those days, and innovation and technology now provide us with even smaller devices and more advanced stents that have proven that they can remain open and have less complications. Sometimes the heart is broken even without a blockage, and that goes into the variety of heart disease where patients can have a heart attack even though there is no physical blockage. We call that the broken heart syndrome that was found many years ago, where the heart muscle apex starts not contracting, and when we do the angiography, we don't find much of a problem. We think it's caused by coronary spasm of the artery, and that goes back and takes us to that stress level. This was a short summary of what can be done. Here at Hurley Medical Center, we have our coronary care unit where we care for patients who have acute coronary syndrome or what we call a heart attack. We have our cardiac catheterization lab where we can intervene when needed and potentially save a life. We have our echocardiographic imaging department, our cardiac and pulmonary rehab where we take patients after an event and prepare them to get better with exercise and lifestyle changes. Telemetry floors are here to monitor patients' heart rhythms at all times. And this was summary to remind you of 3 things to learn from a child. Number 1, to be happy for no reason. It's not always easy. To be always busy doing something good. And to know how to demand small things without ego. I'd like to finish with this. The most dangerous thing about heart disease is a strong memory. Live well, live healthy. Thank you very much for listening.
And Bruce on our Facebook said, thank you for the presentation. It's important information. And Kayla says, wonderful explanation, Doc. So Dr. Mohammadou El-Khattab is joining us from the El-Khattab room in the Hurley Medical Education Center. So we do have lots of questions coming in for you, Doctor. So first off, by text, someone asked, should I see a primary care doctor or a cardiologist? How do I know which one to go see?
Thank you for the question. Definitely, you should always start with your primary care physician. They are the ones that can point you in the right direction, only if needed at that point, and they feel that they need the guidance or help or management of a cardiologist, would they refer you at that point?
We got a question from Rosie. She says she's 65 years old, that she only weighs 138 pounds, but she's getting tired quickly and feels her heart beating rapidly. What does that mean, and what should she do?
Number 1, I like Rosie to think of herself as 25 years old plus 40, so that first will help. But from there, Rosie, you should definitely get in touch with the primary care doctor. Unfortunately, those symptoms can relate to many body organs. It could be related to a heart problem, but it may very well be something else, as simple as a thyroid problem or other abnormalities in your electrolytes or functions. So I would start by seeing your primary care doctor. They would start with your physical exam. They'll probably run some labs. And if they feel that it's necessary for you to see a cardiologist, they'll send you our way. We would do an echocardiogram. We would monitor your heart rhythm and try to determine what the problem and suggest solutions for it.
Sharon says, can I make an appointment without a referral for a heart checkup?
I think that's a question for an insurance company rather than the physician. We're more than happy to see any patient who is able to come to see us.
What about, Scott says, do I need clearance from my cardiologist before I have some other kind of surgery?
It's a good question. It depends on Scott's general health right now. Has he had heart trouble in the past or not? If he did have heart trouble, was there any treatment with stents or other devices? That would dictate that need. However, if someone is well and healthy, has never had a heart problem per se, I think their primary care physician can simply clear them or risk stratify them to have surgery without a problem.
This is kind of a lengthy question, but it says, why is my heart rate often over 100 when I wake or sometimes while watching TV? I walk quickly most days a week, 16-minute miles for 30 to 60 minutes. I wore a heart monitor but found nothing. Now, I know you can't diagnose over something like this, but I think this person's really wondering is what tests should they have done?
I'm going to give a very general answer, obviously. If the workup has been done and no abnormal rhythms were noted and no what we call structural heart disease was uncovered, there is an entity called inappropriate sinus tachycardia, which is generally benign, but it's extremely uncomfortable. There are ways that we can help with the symptom that this entity points out. And unfortunately, I can't go into any more details, not knowing the patient's medical history or the workup that has been done or their age.
Dr. El-Khattab, Dawn says that she was told her HDL levels are low. What does that mean, and what can she do to correct it?
That's an excellent question. So a lot of us are either genetically not blessed with having a good cholesterol. So the high density lipoprotein is what we call the good cholesterol. One of the jobs that it does, it acts as a scavenger where it runs in the bloodstream and scavenges the bad cholesterol, removing it from the bloodstream. So it's always better if we have a high good cholesterol. So if we're genetically unblessed to have that, one of the best ways to elevate our good cholesterol is exercise. In fact, we haven't been able to pharmacologically, meaning with medication, elevate the good cholesterol in a safe way. The best thing that works for it is good exercise and a low-fat diet. When I say low-fat, I'm talking about saturated fats, bad fats.
This question is, if you have had a myocardial infarction and your heart was damaged significantly, what does that mean for your future? Does it heal over time or repair completely?
So what I said in my presentation, without hope, there's nothing good. And the human body and the human heart is resilient. And when it's given the proper care and when the patient and the doctor work together at improving things, miracles happen. And I call them miracles. They're not necessarily miracles. We've seen many patients improve, whether there was extensive damage or not. Now, improvement comes in two varieties. There's symptomatologic improvement, meaning patients feel better, they act as if they've never had a heart attack, or the function of the heart becomes also better. In short, even if there was damage to the heart muscle, it's never too late. And in fact, the alternative is not good. Giving up and sitting by and accepting the status quo is not an answer. One of the beautiful thing about heart disease treatment, it works and patients do get better.
Dr. El-Khattab, thank you so much. I know you have a very busy schedule, and we appreciate you coming on with us and answering these questions. I'm sure it means a lot, and it means a lot for the hospital as well to have you communicating with people. So thank you.
Thank you so much. Thank you for having me.
You're welcome. I do have a few questions for Dr. Cutler. We're going to try to get her on to answer a few of these. Hi, Dr. Cutler.
I do.
The first question is, my son is husky. He eats well, he exercises. Should I get his heart checked, or am I being a paranoid mom?
I think that's a great question. Just because you're obese or husky does not mean that you have heart disease. It does put you at risk for heart disease later on. So I think it's something that you should really speak with your pediatrician or family doctor with some type of strategy to help with whether it's not necessarily weight loss, but not gaining weight as he gets taller and grows.
Brenda says, my child says she feels her heart race. The pediatrician told us it's nothing, but only listen to her heart. Should I be concerned?
Anytime your child complains about something, whether it's chest pain, palpitations, the heart's racing, or dizziness, as parents, best you can listen to them. I'm going to give you a suggestion. There are apps that you can download on your phone for free where you can put your finger back by the camera, and when you open that app and push measure or whatever it says to do, it will measure the heart rate. It will give you actually how fast your child's heart is beating. Pain, stress, anxiety can increase the heart rate and it get up to maybe 130 or 140 if they're just sitting doing nothing. So that would be an important number to when you talk with a pediatrician or family doctor again, to have that and say, when they're saying that it's going fast, the race, this is the number that I got. And then they can decide if it's something that needs further evaluation.
Children's hearts grow, obviously, over time. So people are wondering, is there an age when you're too young to have your heart checked, or if you need to keep having it checked every few years after you're growing up?
In answering that question, I first have to ask, what do you mean by check? When the pediatrician or family doctor is checking your child out, they're listening to your heart, listening for heart murmurs, listening for her heart, how fast it's going. They're checking the blood pressure, and they're asking questions. And there's important questions to be asking to know whether to be suspicious for a heart problem. So if you're talking about a general check, then it's never too early. If you're talking about the heart screening that you hear about, like that's offered for community, when we talk about those screens, they usually start around 12 or 13 of age, because we found that it's around that age and older that the intensity of the sports or play that your child is playing puts them at that high risk. That's not to say that a younger child can't have some type of unexplained sudden cardiac event, but it's not something we would necessarily see in green and those types of things that are done for the community, such as what her had.
Dr. Cutler, we feel so fortunate to be able to team up with Michigan medicine pediatric specialists like yourself so that people can actually get the expert care that they need right here in our area. They don't no longer have to drive across the state to appointments or to see the people that they believe are the best for their children. So the fact that you're with us, we really do appreciate, and we appreciate you taking the time to come out and give people information and answer some of their questions. Thank you so much.
Thank you so much for having me.
And thank you, everybody, for joining us. We hope this was helpful. We know your heart is important to you. It's important to life. So we really hope that you were able to get all of your questions answered by the doctors. And also with Hurley, you know your heart is in the right place. Thank you and have a great day.